One of the mysteries of this coronavirus, because it's new, is what's next for those who've already battled the disease. New tonight, growing evidence that athletes who have contracted COVID-19 could face long-term health effects even after they recover. Recent studies show an alarming number of cases of myocarditis, or inflammation of the heart, in those who've previously tested positive for the virus. 3 News investigator Rachael Polansky is breaking it all down for us.
I love opening day. I love baseball.
3 News digital producer Dave Dino DiNatale will never forget his sophomore year of college.
I had what I felt like was bronchitis.
And after 6 days of riding it out, he took himself to the campus clinic.
They did a chest x-ray, and that's when they discovered that my heart was enlarged because of the myocarditis.
Myocarditis was a life-changing diagnosis for DiNatale that meant hanging up his basketball jersey and starting on medication that he still takes today.
Thanks to medication and doctor's care, it's something I've been able to live with.
Fast forward 20 years, Dr. Kurt Daniels at OSU has discovered myocarditis in 10 to 13% of the athletes he's tested who previously tested positive for COVID-19.
There appears to be a somewhat higher rate of cardiac involvement causing myocarditis with coronavirus.
And that's in line with studies being done across the country. The Journal of the American Medical Association studied 100 patients who had recovered from COVID-19. Heart imaging showed cardiac involvement in 78% of them.
So we do know that this does happen, and it happens in the community with athletes. And we're still not sure of, again, the overall impact of what that means.
1st and 10.
That's why athletes who recover from COVID-19 should still monitor themselves closely.
Touchdown!
And talk with a doctor if cardiac symptoms arise, like chest pain or shortness of breath.
It's going to be determined by the provider, again, based on age, activity, and symptoms.
While it's an evolving science and more research needs to be done, DiNatale urges athletes to be cautious.
I just thought it was important to, put a face to the condition and say, number one, it's serious. Number two, it is treatable, but it's nothing to mess around with.
Myocarditis is generally mild and goes away with rest, but if left untreated or undiagnosed, it can cause heart damage or even sudden cardiac arrest. Rachael Polansky, 3 News.